Here at Alliance Bank, we have discovered that true wealth lies not in the world or what it can offer. True wealth lies in the hard-working hands of a dreamer. True wealth is being around people who add meaning to our lives. These are the people who are always there for us, in times of success, and even in challenging times, they're always there. We have learned that through all of life, family is the one constant. And Alliance Privilege is just like family. Helping individuals tell their stories, helping families achieve their dreams, and helping generations share their legacies. Family and Alliance Privilege. The future's always better together.
Thank you so much for joining us here in this Alliance Bank Lifestyle webinar. And definitely today's session is specially brought to you Medical Center. Well, speaking about today's topic, we will be touching on beauty and wellness. Ladies and gents, my name is Kaylee, your MC for this wonderful session. Well, folks, we all understand that living a healthy lifestyle improves our appearance, making us look more beautiful, isn't it? The health of our skin is an indicator of our overall health. But what makes every one of us do not know, or I should say, what many of us do not know, do not realize, is that the connection between beauty and health is just so strong. So right here, we are very honored to have you joining us for this wonderful session, as we'll be touching on two topics you must be very interested in. If we all put our attention on the medical industry, we all know that in these past 10 years, aesthetic medical practice has gained popularity, and the reason behind this trend is people want to not only stay healthy, but also be aesthetically pleasing. So here today, we are honored to have Dr. Tristan Tan from Vinci Medical to allow ourselves to understand more about the following aesthetic topics. So today in Dr. Tristan's sharing, he will be touching these three topics, and they are the importance of blood screening, anti-aging and wellness treatment, together with leave program and Ultherapy. Not only that, ladies and gents, we all know that cancer being one of the major healthy problems in Malaysia, we are also honored to have Dr. Jennifer Leong from Sunway Medical Center to join us here today and share us these cancer knowledges that you must know. And they are top 5 cancers among Malaysians, early warning signs of common cancer, screening tests, followed by advancement in cancer treatments. So here, up on screen, I have these lovely sessions together with every one of you. Yes, honored to have you here. So here, ladies and gentlemen, we hope you can enjoy the great sessions together with us here, because with today's sessions, you not only get to know these informations, the knowledges, but at the same time, we will be also having a Q&A sessions. If you have any questions to the topic Dr. Tristan has mentioned, or Dr. Jennifer's have shared with you, feel free to drop your questions at the Q&A column. All right. So here, ladies and gents, we also like to remind you that coming up next to our sessions of the day, we will be also having one lucky draw sessions, allowing you to walk away with fabulous prizes. So make sure you stay tuned with us and be here with us to the end of this live stream. All right. So here, let's begin with an introduction of our speakers of the day. So today we'll begin with Dr. Jennifer's sharing. So here, for you to know more about Dr. Jennifer's. Ladies and gents, Dr. Jennifer's graduated from International Medical University, IMU, and spent the early parts of her medical career working in Penang General Hospital before specializing in clinical oncology. She obtained her master's in clinical oncology from University of Malaya before going on to practice at the renowned National Cancer Institute in Putrajaya, where she was a resident clinical oncologist. She is skilled in various advanced techniques of radiotherapy planning, including intensity modulated radiotherapy, or we know it by the name IMRT, volumetric arch therapy, VMAT, and tomotherapy. She also performs stereotactic radiosurgery, SRS, and stereotactic body radiotherapy, SBRT, and is widely experienced in 3D image-guided this brachytherapy planning for various gynecological malignancies. While she is actively involved in medical research related to the field of clinical oncology and has held the position of primary investigator in several clinical trials. And her special interest lies in the treatment of breast, lung, and gynecological cancers. For information, she is a member of the Developmental Group Committee for the latest National Clinical Practice Guideline for Breast Cancer, year 2020, and is a regular guest speaker at medical conferences. So here, without further ado, I think I shall hand the floor to Dr. Jennifer. Dr. Jennifer, over to you. Well, right here, thank you so much, Dr. Jennifer, for joining us. And if I may, can you please unmute yourself so that we can hear you?
Sorry.
Over to you.
Rookie mistake. Hi, good evening, everyone. Thank you so much for the kind introduction, Kelly. And thank you everyone for joining us this evening. So I'm very honored to be here today. So my name is Jennifer. I'm a clinical oncologist at Sunway Medical Center. So let's get started. So today we are going to talk about the significance of detecting cancer early and how it can save life. So the word cancer is very much dread upon by many. So it's almost a taboo in our society. So when I see a patient as well as their family members, and there's a lot of time, you can see fear flashing across their face. And the common question that is asked to me is, will I be cured from the cancer? And do I need chemotherapy? And of course, the discussion will always go into the cost of the treatment, which we know is escalating in today's era where there are more and more new cancer treatment available. And we can't shy away from treating cancer. So cancer isn't just treating the disease per se, but we also deal with the psychosocial, emotional well-being of the patient. So there's a lot of anxiety, fear and worry, as well as uncertainty when it comes to the patient, the coping mechanism, and also a lot of time that uncertainty also translate across the family members. So as a clinical oncologist, it is my role to care for the patient, and sometimes it's all the whole family when it comes to just to treating this disease. So what is cancer? So cancer is essentially an uncontrolled growth of abnormal cells in the body. So our body has signaling process where when there's an abnormal cell, it should detect it. Okay, we have tumor suppressor gene, we have the gatekeeper gene in our body. And so when this becomes faulty, the cells continue to grow and become a mass or a lump, and this is called a tumor. And the difference between a malignant tumor and a benign one is that malignant tumor or cancer has the ability to spread beyond the primary site. So it can then spread to areas such as the liver or the lung and bone and causes pain and sometimes obstructive symptoms, and that's when patient starts to develop symptoms. So how common is cancer globally? As you can see from this chart, it's not the latest chart, but it tells us that cancer is the second most common leading cause of death worldwide after heart disease. So 1 in 6 deaths globally are caused by cancer, and up to 1/3 of cancer-related deaths are related to factors that we can modify, such as diet and behavioral risks, such as obesity, lack of exercise, unhealthy diet, as well as there are a few cancers that are related to the use of smoking, to the practice of smoking, as well as alcohol usage. So what about in Malaysia? So this is the latest National Cancer Registry, which captured new cancer cases in Malaysia. And the latest one encompassed the data from 2012 to 2016. And you can see the one in yellow is the cancer cases among the male, and the female is the one in the salmon, orange color. So the most common cancer among male are colorectal, followed very closely by lung and prostate. And for the female, breast cancer is the most common cancer, followed by colorectal, lung, and then cervix as well, and ovary. But what I really would like to highlight you is this data here. I'm not sure if it's small and you can see. These are the common cancers that I have mentioned earlier, like breast and lung and colon cancer. But the one in the red box tells you that a majority of Malaysians are still presenting at the stage of 3 or 4. And we know that stage 1 and 2 are the early cancer staging, so where the prognosis or the survival rate is better. So at stage 3, the cancer has already become quite advanced, locally advanced, and sometimes surgery may not be possible upfront. And stage 4, of course, denotes that the cancer has spread beyond the original or the primary site. So we are still seeing a significant number, if you can see the percentage on the right, that more than half are still presenting at stage 3 and 4. But we know that we have more and more campaign and awareness program over the last 10 years, over the last decade. But why is this still happening? So why is it important for us to detect cancer early, to actually continue to raise awareness among the community, to look for early signs and symptoms? Because the staging or at which stage the disease the patient present with is very closely associated with the survival rate in the patient, or in medical terms, we call it prognosis. So if you look at the chart on the right, you can see that for a very gross overview of 5 years survival rate upon diagnosis of ovarian cancer in a patient who get diagnosed at stage 1. So at 5 years, there is a 92% chance of them surviving beyond 5 years. But if they were to be diagnosed at stage 4, only 17% will still be alive at 5 years. So it clearly tells us that the prognosis or survival rate is very much associated at which stage the patient presents with. And the reason is because early detection is to detect the cancer when it is at precancerous stage, or ideally when actually the individual have no symptoms or minimal symptoms. And so hence the cancer has not spread to the surrounding tissue. So the sooner the cancer is detected, the more effective the treatment is likely to be, because you are targeting a smaller amount of tumor burden. So this provides the best chance of cure. So the word here we use is cure, and we always try to have cure for our patient rather than to use the word, we are just controlling the disease. So in short, my clicker. So in short, when the cancer is detected early, you can offer the earlier the treatment can be offered, the survival outcome is improved, and also because it's less complex to offer treatment at an early stage, it reduces the treatment cost incredibly. So then I'd like to talk about screening tests. As a clinical oncologist that see patients who come in at advanced stage, I think there is still a lack of awareness of screening tests among Malaysians. So what is a screening test? It's essentially a test that is done to detect potential disease in an individual before they have any symptoms. And this test should be reliable and also cost effective, because we need to apply it across the community. So these are the common screening tests that we have, and is well validated. So for detection of breast cancer, we know that mammogram is the gold standard screening test. And for someone who have no strong family history, the recommended starting age to start mammogram screening is 50 years and above. And also it's 2 yearly. It's recommended if your mammogram is normal, then you should repeat it 2 yearly. But if you have strong family history of such as breast and ovarian cancer among, say, a mom or first-degree relative like maternal aunt, then that screening can be moved earlier by 10 years, so at 40 years and above. So Pap smear also saves life. With the introduction of cervical smear or Pap smear, it reduces the incidence or the cases of cervical cancer dramatically in the last 30 to 40 years. So these are recommended for all women who are sexually active, and it is done 3 yearly once if the initial Pap scan is normal. But a lot of time, because we are busy, we are working, juggling motherhood and juggling work, we tend to put this thing at the back of our head and say we were going to slot it in, but sometimes you don't. And then sometimes when you get detected, it can become a bit too late. So for colon cancer, there are 2 recommended methods, which is the fecal occult blood, which is the non-invasive one, or colonoscopy for the moderate to high-risk group. Or if the fecal occult blood, which is actually basically taking a stool sample to look for blood or occult blood in the stool sample, if that is positive, then the patient or the individual will be advised to see a gastroenterologist to then get further assessment for scope. Then again, the recommended age group to start is 50 to 75 years old. PSA is also recommended for detection of prostate cancer for 50 years and above. And again, low dose CT, again, is very selective. It is for especially those who have high risk, such as a chronic smoker. Then we can offer them low dose radiation, low dose CT, meaning very low dose of radiation, yearly CT scan. So I'd like to talk shortly about what is the current available cancer treatment options that we have. So of course, if the cancer is detected early, it's almost inevitable that patient would be recommended surgery first to remove the gross tumor. And then there's always the adjunct treatment or the supportive treatment, such as radiotherapy, systemic treatment. This is where chemotherapy, targeted therapy, or the latest one, immunotherapy comes in. And we should not shy away from supportive therapy because we know that these are all very important to support the patient through their journey. So let's look at what are the current radiotherapy machines that's available. At Sunway Medical Center, we have 3 machines, mainly primarily gamma knife, which we use for brain tumor, true beam, and tomotherapy. Just a little bit more about radiotherapy. A lot of my patients ask me, is it painful when I go through radiotherapy? No, it uses mega voltage X-rays, and it's actually painless when the beam enters the patient's body. But the side effects are very much related to where the site of treatment is. Of course, if the treatment is related to head and neck, so over time, the patient may develop sore throat and some skin irritation over the neck. But it's important to assure the patient that this is actually temporary. And with a lot of supportive treatment, they do get through their radiotherapy well. And more beautifully, radiotherapy does not need admission. So you can just do it as outpatient, around about 20 minutes, and then the patient can go home and even resume work. So again, what is gamma knife therapy? So as opposed, ironic as the name sounds, gamma knife does not involve surgery. It's actually akin to surgery. So what it does is it's an alternative treatment option to open brain surgery. So there's no incision needed, but we use multiple very small radiation beam to target a very precise area in the brain. So like how I say it is like coordinating where the GPS coordinate is and telling the machine to hit one particular area. So we use this a lot for like benign brain tumor, even for like arteriovenous malformation, and also for malignant brain tumor. So like brain cancers that the patient is not suitable for surgery, then we use very high radiation dose to target a very small precise area, and the outcome is remarkable. So let's look at the next slide. So this is a MRI of a patient with lung cancer, and we know for lung cancer, the risk of it spreading to the brain is very high. So this patient has got one brain lesion in the brain due to the lung cancer, and after gamma knife treatment, you can see after 4 months, it has completely resolved. So what about the systemic treatment? So currently, systemic treatment means a treatment that when you administer to the patient, it goes through the whole body. So it targets the cancer cells entirely. So currently, we have chemotherapy, targeted therapy, and also immunotherapy. So I know a lot of patients are very fearful of the word chemo. And sometimes that itself may also hinder them from actually being diagnosed early. Because just, the thought of having seen someone in their family undergo chemotherapy and maybe did not do very well with it can actually have a stigma on the patient. But we always try to balance. I think it's important as an oncologist to have an open discussion with your patient and tell them the risk and benefit of actually having the chemo. And at the end of the day, the patient get the autonomy to decide if they should have the chemo. So nowadays, the chemotherapy has gone a long way. So there's an oral or injection form. It's not always an injection form. And we also have newer supportive treatments such as better anti-vomiting tablet, as well as booster injection post-chemo to reduce the risk of them developing fever. And some of them does not like to have their hands pricked multiple times. So we have what we call a chemo pot insertion to make it easy for the patient. Just shortly on what targeted therapy is, because this is becoming the new mainstay treatment in a lot of different kind of cancers, such as lung cancer, kidney cancer, and breast cancer. Basically, we will send some tests or some blood or some tumor testing to look for a specific receptor in the patient. So if you have, so how I put it to simplify it for my patient, you are looking for a door. So if you find the right door, because every patient has got different kind of receptor or door, then you use the key or the drug to lock it up. And what it does, it prevents the tumor from getting the signal to grow. So this is a more effective way of treating the cancer because you know what is driving the tumor, this door or this receptor. So you are going to inhibit that door by actually using the correct treatment. So that's why the word is targeted therapy. And lastly, we know more and more people are asking me in the clinic about whether I can use immunotherapy. So immunotherapy is the latest systemic treatment to hit the oncology landscape. And what it does is it actually allows the immune system in the immune response in the body of the patient to fight against the cancer cell. So like this cartoon shows us, sometimes the cancer cell is very naughty. It actually closes the eye of our policeman in our body or the T cell. So the T cell does not recognize who is bad and who is good. So what immunotherapy does, it actually unlocks this binding, and then the policeman is able to detect where the bad people is and kill it. So it's a very novel way of treating cancer. And the treatment has so far been remarkable, and we use it in lung cancer, kidney cancer, triple negative breast cancer, and almost more and more cancers are showing good result with immunotherapy. And I think it's very important when we see the patient, we don't just talk about treatment, drugs, but we have to support the patient as a whole. Like I said, there's a lot of emotional factors that comes into play. And when your patient is well emotionally, they're also more compliant to their treatment. So this includes actually engaging them in the survivor network group, because a lot of patients feel very lost. And sometimes they don't really want to share the burden with their family. So I think having another survivor, like a breast cancer survivor, to share their treatment journey is very, very important. Complementary medicine also play a role, whether we, as a clinician, we liked it or not. A lot of patients are looking into having acupuncture and seeing the TCM physician. So I think as long as they're honest and open to it with us, at least we can monitor the blood counts, and we can tell them when if something is not right, we can actually tailor their treatment better. So a lot of cancer patients are in the advanced stage of cancer, and we need to have the palliative care and hospice. But so many Malaysians are not aware what hospice is, what palliative care is, and they think that you only get to palliative care when you're actually actively dying. And we're trying to change the perception that no, you can start seeing this hospice visit, they can come to your home, they can start talking about bed support, oxygen, and pain control. So all these things comes earlier and earlier in the oncology management. And of course, nutrition. It's important to take care of the patient's nutrition. And also that is the single most common question asked to me. After the end of the consultation, it will be, what can I eat and what can I eat? So it is an important issue to address. My phone just keeps closing, sorry. So finally, for the patient, my advice would be always reach out for support. You may feel like you are burdening your family members and friends, but no, actually they really want to help, but sometimes the words don't come out. So reach out for support because it's important. It's important to maintain hope and optimism because we know that there are more and more new cancer treatment available. So the survival outcome has improved drastically in the last 10 years. And always select a doctor that you feel you can have this discussion with. So I think we'll shy away where the doctor make the decision and you have to follow. So it's more like having this balancing the risk and benefit and what you think works best for you, or taking into account the treatment benefit. So what can we do as friends, family, and colleagues? So it's very important to offer emotional support. And sometimes that just means lending a listening ear. We may not need to talk much, sometimes they just need to unload. And of course, if you're very close, like if this is your sister or mom, then you can offer to help with the household chore. I know patient get very appreciative, especially when someone is looking after their children while they're undergoing treatment. So there's less thing to worry about and they can just focus on their recovery. So usually before we actually book an appointment on oncologist, it will be good if there is a biopsy report available. But if not, then we will help to arrange for one. And sometimes patient comes to us with MRI, PET scan, or CT scan. Again, if it's not available, we'll arrange for one. And then you can call or make a teleconsultation or make an online booking to see one of the oncologists over here. So this is my final slide. Thank you so much for listening. If at all, the take-home message tonight would be early detection significantly improves one's chances of survival. So if you have friends and family members or even yourself that you don't feel well, do not be scared, just seek early treatment. And sometimes the symptoms may be very big, like for example, abdominal discomfort, right? Or, something that you feel you have gone to see someone, but it does not get better, then do always seek second opinion. That is my advice. So early diagnosis reduces treatment costs because it's less complex. And all the new cancer drugs, they have manageable side effects. So do not be afraid. Do not close up your mind. Importantly is to have this open discussion with your doctors and come to a term on what kind of treatment works best for you. Thank you very much.
Thank you very much, Dr. Jennifer, and please remain online together with us here as we have received a few questions from our audience. Well, we have talked a lot about cancers. We have talked a lot about, it's better for you to have your yearly screening to ensure that we can help you in the early stage. Then we help you to control the situations when it comes to the later stage, isn't it? So here, folks, we have received a few questions from you, and I believe that Dr. Jennifer will be very pleased to answer your questions. So Dr. Jennifer, shall we begin with the first questions here?
Sure.
All right. So this is the first questions that we have. With the current global uncertainty, can we get a glimpse of what to expect for those needing cancer treatment in Malaysia?
Thank you for the excellent question. We know the pandemic has hit a lot of people. There's a lot of uncertainty, of course, economic downturn. So unfortunately, the cost of cancer care is escalating because as we see, there are newer treatment, So I think we all need to work together, the stakeholders, in how we can reduce the treatment costs for the patient, increase accessibility to treatment care, because I think only a minority is getting the best of care. So majority are still not being able to receive immunotherapy because of the cost itself. So we need to work together with all sort of parties, how we can leverage this and maybe come up with a better patient-assisted program. Yeah, so it's an ongoing effort.
All right, thank you so much, Dr. Jennifer. And also here, folks, if you have any questions, you may drop it in the chat box and we will answer your questions from here. Okay, so yeah, I have another question from this audience. How much do we need to prepare for cancer treatment?
It's quite a spectrum, but generally for chemotherapy, it costs around about 4 to 7K per cycle. And most chemotherapy standard is about 4 to 6 cycles. Targeted therapy can range between 6K up to about 10K per month. These are usually oral tablets taken daily. Immunotherapy costs between 14 to 20K per cycle. So the thing about targeted therapy and immunotherapy, you do not stop after certain cycles. So usually we ask a patient to estimate up to a year of treatment.
I see. All right, here we understand better on the cost if we would need any cancer treatment. So here I have another question. Is leukopenia a kind of cancer?
No, it's not directly linked to cancer. But if someone has leukopenia, then we need to know if this is something that has just happened, because sometimes infection can cause leukopenia or reduced white cell count. But if the leukopenia is persistent, then perhaps more investigation need to be done to ascertain whether there is something else going on. Yeah, so they include doing like blood tests, seeing a doctor that specializes in blood disorders. Yeah, but it's not directly linked to cancer.
All right. So here I have another questions from the floor. There are many people always say that their family members seem to have died faster after going through the chemotherapy. So most of the cases is that the patients could not even survive from the chemo treatment. How can we, assist them in curing their cancer? So is a very tricky questions, and I believe that only the professional can answer it. Dr. Jennifer, what says you?
I think chemotherapy has given us a very bad image over the last, however long we've become an oncologist. So we're trying to change the mindset, but it's not easy, right? So we try to shy away from using chemotherapy because there are newer, targeted therapy that we can use. That if there's an option, we try to always shy away. But chemotherapy is also known to save life. So what we need to do is to select the right group of patient. Yeah. So it's very important for the doctors to listen and then to assess what kind of patient is suitable for chemo to start with. Because sometimes a patient with very advanced disease, their liver function may not be good enough for them to undergo the chemo.
I see. Thank you so much, doctor. And here I have another questions from the audience. Well, is there some supplement that link to breast cancer? Or if that is, what type is most common? What type is most common?
Perhaps they have one in mind that they would like to ask me directly. I do not know of any supplement that is directly linked to breast cancer per se. Yeah.
All right, now we know. But I believe that by having healthy diet when you are in your treatment for breast cancers will help a lot, right, Dr. Jennifer?
Yes. So I think having a right frame of mind when you're undergoing cancer treatment, and I think the coping mechanism differ from every individual. So it always start off with denial, and before it finally goes into acceptance. And for the patient to be able to accept their treatment well, to comply with the treatment, is when they are in the acceptance phase. So as a clinical oncologist, I look for the sign and cue when I talk to the patient. Yeah. So having the right frame of mind, having good nutrition and having good family support matter when they undergo cancer treatment.
Thank you so much. And now we have come to the very last questions that we have here. Is collagen, linked to breast cancer? And could you please provide us more details on this?
In what kind of collagen? The edible one?
I believe that it is, well, it's actually a question from our audience. So maybe the audience who have posted this question up, you can let us know more. But let's assume it is the edible one.
I think there are no solid evidence to because when we counsel patients and we will tell them things like even soy product, a lot of my patient with breast cancer are afraid to take them. So we look at clinical evidence, and they're actually not enough to support the hypothesis that this product will inevitably lead to it. Maybe there's an association, but it's not a direct link to causing cancer because it's actually more complex than that. So there could be a genetic factor as well involved in a person developing cancer. So it's not just as simple as, a certain food. Yeah. So environmental factor, genetic factor is a very strong role. So we advocate genetic testing for a certain group of patients with certain cancer, like breast, ovarian, and prostate. So part of us sitting in the clinic include going through their family history. And if we see that there's strong family history, we tell them to go for genetic testing. So that's much more pertinent, I think.
I see. All right. Thank you so much once again to Dr. Jennifer for the great sharing sessions. And here we wish every one of you have gained lots of knowledge from this sharing session, especially brought to you by Sunway Medical Center and Dr. Jennifer. Thank you, Dr. Jennifer. Thank you.
Thank you for the question.
Thank you. All right, ladies and gentlemen, after we have understand about cancer, I think it's time for us to proceed with another topic that we have for the day. Well, this second topic is about aesthetic beauty. So here for this round, we would like to welcome our speaker with great and huge knowledge in this industry. He's no other but Dr. Tristan. Ladies and gentlemen, Dr. Tristan, who has the following credentials: MBBS, Medical, India, diploma in laser dermatology surgery, diploma in dermatology, Cardiff University, diploma in aesthetic medicine from USA, letter of credentialing and privileging LCP certified 001/2017 54 MMC number 44525. Well, are the things that you need to know. But from what I know from him is he's a person with sense. You know how to make you look beautiful. You know how to provide you the right recommendations, the right suggestions, or I should say consultations. Well, if you have consulted him before, I know that his favorite words is this one. We take great pride in delivering the best for our patients. Every patient who walks into our clinic is assured of personalized treatment and comfort. We are passionate about fulfilling their needs and desires because nothing is more rewarding than a smile from those who have put their trust in us. Yes, that is totally right. Well, ladies and gentlemen, I know that maybe with aesthetic beauties or consultations or treatments, you can look beautiful. But isn't it great to look beautiful and at the same time having your own beauty? Is a personalized beauty of yourself, isn't it? So here, without further ado, let Mr. Tristan, or I should say Dr. Tristan, to share us more on this. Let's welcome Dr. Tristan.
Hello, good evening, everyone. Thank you, Kelly, for the kind introduction. I'm Dr. Tristan from the Vinci Medical. I'm very honored and pleased to be able to take some time to share some of the insights of today's topic on beauty and wellness, and also dwell a little bit more into the innovation and the recent advances in aesthetic medicine. Because aesthetic medicine per se isn't something that we have come across during the last 40, 50 years, but it has become pertinent because it involves more of personal image, basically wellness that involves internally as well as externally. So in a brief overview, aesthetic medicine has encompassed not just simple things like we hear about lasers or Botox or fillers. They involve a lot about internal well-being, our internal health, and also the modalities of treatments that are safe and also with evidence base. So I would like to share certain things about aging. That's why we need aesthetic medicine, and also how do we do diagnostics to screen them, and also how do we or what are the new modalities of modern innovation that is currently in our hands. So I would like to introduce our clinic, Da Vinci, because for me, my vision and mission is to individualize natural beauty and also to create a better communication with the public and also to our patients to deliver their needs and wants. So we pride ourselves with FDA-approved procedures and also proper advice that helps them with aging. So before we actually delve more into the different modalities, we need to understand what is aging. So a lot of times, all of us cannot avoid this. So the question is aging a disease or a natural process? So when we see ourselves in a mirror when we were 10 or 20 years old, we didn't really come into mind that aging is an issue. But as we move on to the 30s and 40s, where we undergo certain forms of degeneration or certain forms of illness, we notice that it is somehow related to some form of disease. It is not a disease per se, actually. It is more of a physiological process that all our cells in our body is undergoing and is unavoidable. So if we want to age, we might as well look good aging, right? So one way is to identify what are the factors that actually causes aging. So I've divided the natural causes to both. One is internal aging, or we call it intrinsic aging. And the next is external aging or extrinsic aging. So in one way, what we can see is that the intrinsic aging of our body is basically something that's not modifiable. It's really related to genetics and also our biological age. So genetics basically is something that is carried through families. So certainly certain types of just say premature aging or certainly some form of skin laxity can be genetically caused. But I'm more concerned basically of the extrinsic aging because it's something that we can modify, we can change, we can improve. So external aging basically is something that is more related to our lifestyle and environment. It's something to do with photoaging, where exposure to excessive sunlight or UV radiation can cause premature aging, degrading our skin layers. And also it translates to forming of pigmentation or even premature wrinkles, and also noticeably change in skin color or even thickness of our skin. So we have to understand a lot of times that the changes of our skin structures in specific, because aging is relatable, can be visibly seen through our skin. All right, so we have to know there are many layers in our skin. Basically, the fat layer, which is the deeper layer, which we lose volume as we age. The superficial layer of the dermis and epidermis, as translating as in their color as well as texture, as well as elasticity and hydration, and as well as the vasculature, which is the blood vessels that sometimes can be more prominent as we age, as the skin thins out. So these are some changes that happens, but identifying them and also knowing how to somehow slow it down is actually part of what we do here every day. Um, so clinical consequences basically do relate physiologically as well as causing diseases. So these are mainly because of degradation or degeneration of the loss of collagen, elastin, as well as the hyaluronic acid, which actually provides the support for our skin, right? So if we know the aging process of what causes or accelerates aging, we have to identify the objective reasons of what we can do to find out more, to help to improve or to reverse or even to stop the aging process. All right. So, what are the diagnostic indicators that we commonly do in our clinics? I think more and more is moving towards prevention, or what we call as regenerative medicine in aesthetics, because one way of actually slowing down or preventing illnesses is first to prevent, as like what Dr. Jennifer has mentioned before. If we are able to identify the problems earlier, we can actually prevent, and more or less after when we initiate the prevention treatments or the prevention methods, we can slow down the process, or there's a higher chance of cure. So in our practice, it's very similar. We always want to have a diagnostic indicator to find how well or how healthy the patient is, and also advise them so that in one way we can help them to treat internally, and that translates to their external appearance of helping them to age better. So it's not just about doing simple treatments and all that just to treat it externally. We have to work with them internally to make them understand how to improve their health. So wellness is one thing that we take a lot of attention in. And one of the most important things are blood screening. So when we talk about blood screening, it's something that's really affordable, easily available, and we are also able to find very simple indicators inside there to help our patients to improve their health. So what does a normal blood test show? So I've actually listed or give a simple 10-step or 10 indicators that we are looking to actually identify the wellness concept in aesthetics medicine for patients to go through when they come to us. So these are the 10 important blood tests for adults who are going through an anti-aging treatment with us, and also to identify their internal wellness. So first is the complete blood count, the CBC. It encompasses the test of their blood cells, their red blood cells, white blood cells, as well as their platelets. These are very important indicators because they are able to help us to identify the components of what is normal for them. A lot of patients actually are anemic, or they actually have low blood counts in their red blood cells, leading to a more pale color for their skin, making them looking unhealthy, and also could relate to their symptoms of lethargy, fatigue when they work, or they can't actually have a proper lifestyle. So this is one of the important components of identifying if the patient has enough blood cells in their body. If not, then we will advise proper supplementation, or even there is new innovations to do intravenous parenteral supplementation of iron for those who are having iron deficiency anemia. And these are very common in females because these are actually quite common in our clinics. We meet a lot of females. They have internal issues that we can identify, and just by doing a simple blood count, we can help them to reverse and also to improve their nutrition status as well as their general wellness. All right. So The other tests are involving infection in the white blood cells or even in the platelets, just as it's shown here. The importance of it is also to identify the nutrition status of the patient and also to go through more deeper with them if at all they're not eating that well. Because some patients, they do have a skewed angle of beauty, like they are bulimic or basically they are anorexic, and they do suffer from nutritional deficiencies that needs more proper attention. And therefore, by doing a simple blood test, we can identify all these factors. The others are like what Dr. Jennifer has mentioned, like screening can identify certain forms of cancer, also immune system disorders, or even certain forms of allergies. If the patient is suffering from skin problems that relates to eczema or even certain forms of dermatitis that is relatable to their skin health. All right, so the next important thing is to identify their blood sugar levels. So certainly if uncontrolled blood sugar can lead to certain skin changes that might make them look sallow. The skin can have lipodystrophy, it can look thinner and look unhealthy. So this is the second most important blood test, and it's quite common in Malaysia to actually be a diabetic because of the diets that we go through, all the teh tarik's and all the high sugar level of foods that is going to cause a lot of problems in aging patients. So this is a very important indicator for us. So knowing what's normal and how to advise the patients to take more complex carbohydrates, less sugary meals, and also to deviate away from unhealthy processed foods are also part of what we are able to help them with. So the next is, of course, our lipid profile, cholesterol. This is the third most important blood test. We want to know how healthy they are. Are their fat metabolism doing well? Are they able to take in proper healthy fats and avoid unnecessary high-calorie foods that contains unhealthy fats? So we do delve into the specifics of their total cholesterol levels. Also, high-density lipoprotein, which are the good cholesterols. We encourage them to take a little bit more of plant-based oils like olive oils, also certain forms of omega-3, omega-6, and to avoid the bad ones are like the low-density lipoproteins that are found in meat, and also those triglycerides that can cause heart disease, that can also affect the appearance of their skin as they age. So the importance of all this is to know that their blood levels are well controlled, and also a yearly screening for those age 40 and above is recommended. That's what I would advise them to do. The next are the basic metabolic panels, basically to understand are they able to detox their body well? Are they able to retain certain forms of electrolytes in their body well so that they can function properly? So these are involving their liver function, kidney function, as well as their proteins in their body. So in a easy summary, we're able to see that is the patient able to or taking a proper balanced diet by knowing some of these parameters. All right. So the next most important thing is their thyroid function. Basically, thyroid function imparts the function of metabolism, where they are able to metabolize energy. Either they can thermoregulate and also affects mood. So a lot of times, if the patient is a little bit more stressful, it's not related so much as their lifestyle. Sometimes it can be because of imbalanced hormones of their thyroid. So this is a very important test for us to know: are they able to metabolize their their cellular structures properly, or are they having certain forms of abnormalities that might need to have some adjustments? Okay, so thyroid function test is the fifth most important. Next. So a lot of times there's two types of hormone imbalance for thyroid. They can be either excessive or they can be either reduced or insufficient. So if they are basically insufficient thyroid hormones, they would have certain forms of symptoms like depression, or they have lack of energy, or they have obesity, or they put on weight really easily, even though they don't eat too much. Then the other spectrum is when the thyroid levels are in the extreme, then they have certain forms of anxiety, tremors, stress related, have mood swings where they are a little bit more hot tempered. So it's basically relatable to their daily lives and how they perceive their moods as well. And they would have excessive weight loss. They might have signs of eye changes. They might look like they are staring. and all these other symptoms. So we are quite wary about this condition because it is quite common in Malaysia as well. All right, so some of the parameters that we notice here, but I won't delve too much into this. The next that we look into is basically the inflammation panel. That is actually what we call as the CRP, the C-reactive protein. This is very important because in aging, if our body undergoes extreme forms of inflammation, oxidative stress, we tend to actually suffer into more of an aging process that is a little bit more accelerated. So this is one of the indicators that we know if the patient has high levels of inflammation, most likely they are either not sleeping well, or either they are taking foods that are harmful for their body, their lifestyle involves smoking, alcohol, or lack of sleep, then this parameter can be a little bit abnormal. So this would be another indicator for us to watch out for if we want to help the patients to age or to feel better about themselves. Okay, so these are some of the parameters that we look into. The normal levels are anything below 1 milligrams per liter. Anything that's above 3, we'll consider as high risk. And there are treatments for this. And also, there are indicators if just say that it is too high or significantly high persistently, we will do more further investigations for this. The next important testing we look into is the clotting and coagulation profiles, because vasculatures also bleeding can also lead to a little bit more of loss of function for our body. And this is an important indicator also for us. The next indicator is the tumor marker test, because sometimes early detection saves lives. And also we do refer to the respective doctors to actually do more detailed studies if just say we detect anything abnormal. So this is part of life-saving, but aging does have its ailments, and we do look into tumor markers as well. So specifically for males and females are slightly different, but we do a simple blood test that can actually detect different levels in males and females. The next most important one is DHEA. DHEA is a hormone. This is related to our kidneys in the adrenal gland. It produces males and females hormones, and there are precursors for them. So this is actually very important because DHEA comes in supplementation, and by improving our DHEA or maintaining the DHEA in our age, it helps to actually reduce aging. So this is one of the anti-aging hormones that is very important, but a lot of people might not do this specific testing, but we do advise anyone above 40, 45, they can actually do this test to identify their levels, and also to know that if they are low, they can supplement it and they can actually feel better. Because estrogen is really important for females. As menopause happens, they lose the estrogen levels in their body, but of course, not excessively. That's why blood test is recommended to maintain a sufficient level so that they can age better. And also for men, testosterone levels are extremely important. Loss of libido, impotencies, hair loss, or even weight gain from the waist, they are also relatable to this hormone as well, because low testosterone levels can cause some form of incapacitation for male characteristics also. And the final test is basically to identify if they do have underlying infections. So we recommend that all the patients who come to us to do screening for their STDs also as well, because it involves the partners, it involves their people who they love and those who are close to them. So avoiding any forms of infection or disease is pertinent to healthy aging. All right, so this is basically certain forms of summary that we do in here in Da Vinci, the general screening, the hormonal panels, which is very specific for males and females, the stress panels for cortisols, as well as the C-reactive proteins for inflammation, and also the regenerative hormone, the insulin growth factor, which is also part of how we identify if the patient is aging properly also or not, according to their age. This is another one. We do a lot of nutritional studies for patients also, as well as one form of understanding how are they coping, because Malaysia, you'll be very surprised, vitamin D deficiency leads to osteoporosis and also other symptoms such as depression, mood swings, giddiness, that is not normally done in a normal screening. So these kind of nutritional levels are extremely important for us to find if the patient is supplementing well, are they in their normal levels, and maybe by adjusting or improving their nutritional status, the overall sensation or wellness, they can be addressed also as well. So the other ones are like what we mentioned earlier, the tumor markers, the diabetic panels, and the infection panels. So I'll just summarize it in 10. So I hope that's helpful for us to understand. There are diagnostic tests for us to know and to do to identify and also to prevent premature aging, as well as to improve our wellness. So what I do start is not just the external appearance. A lot of patients who comes to our clinic, basically, they know what they want to do. They want to do certain forms of lasers to treat their skin. Basically, it's more in the corrective dermatology, or to help them with their acne skin, to improve infections, or to treat their acne scars. But that is also part of what we do. But what I want to really speak about is more on the internal wellness first, and then we move on from internal holistically towards external. So internal, external is extremely important for us. So wellness treatment for me is very personalized, because we believe that everyone ages differently. Everyone has certain concerns that they need to be addressed. And we need to support all these issues with them in a very comprehensive consultation. And we need to actually understand how are they aging themselves, and what are the factors that helps them to modify their extrinsic aging, so that they can actually live better and understand more objectively what they can do. So one of the anti-aging and wellness treatment that we advocate in Da Vinci is basically certain forms of autologous stem cells. What we call as autologous means like we derive the cells from our own body. So our cell structures are meant to repair itself. If we injure ourselves, if we just say we cut ourselves today, the next 1 to 2 weeks, our body has a regenerative capability to repair and to restore its normal function. So one of the modalities of treatment that we do for Da Vinci is that we employ autologous, means like we want to use the patient's own cells to help them to repair. So mesenchymal cell therapy or adult mesenchymal stem cells are derived basically from the patient's own body. So, and as example for patients who need recovery from, if correct me if I'm wrong, like leukemia, they do have tests, or they do have a procedure where they store the umbilical cord of the baby. In event that if the patient has leukemia in the future, they can use the umbilical cord as a treatment or a therapeutic to grow the stem cells, to re-inject back into the patient with leukemia, and to improve or to cure or save the patient. So the advent and the innovation of such thing has happened right now, right here. And this is something that I would like to share, because stem cells has also gotten a very bad name, because a lot of people is using stem cell as a marketing tool to sell or to commercialize healthcare. So I would just like to take a bit of time to just maybe explain why autologous stem cells are important for us. So autologous stem cells basically is to help our body to repair or regenerate. So we use them to repair our joints, basically our organs, and also to help our body to actually repair itself in a better way. Because as we age, we have senescence, we lose our body cell counts. So these are one of the ways to actually redeploy them into our body intravenously and to improve our degenerative problems. So these are all done by infusion, all right? Infusion therapy through intravenous. Okay, so stem cells are part of it. The other one is basically infusion therapy of nutrition as well. So these are actually very important, because they help to support and to promote certain forms of aging, especially those who are wanting to improve their weight loss, to actually detox their body, to increase energy levels, by promoting certain forms of cardiovascular health. So infusion therapy basically is very specific also as well, because there's something that is clinically proven, something like called chelation therapy. Chelation therapy is basically to remove heavy metals from our body, because of certain forms of high levels of metals can cause toxicity. The other parts are actually to support cell metabolism, like vitamin B, which is quite commonly lacking in our diet, and also to improve certain forms of vitamins in our body and nutrition, such as microminerals, magnesium, to improve our cellular function. So, okay, so these are all a bit more on the internal. I hope I'm not boring you all, but this is something that is quite intricate. I would like to share a little bit more. Can we go next? I will share a little bit more onto the external treatments, on where it's more relatable to aesthetics. Can you go next? Right. Okay. I think we have shot the gun. Sorry. Okay, not the video. Okay. So diagnostics are important, understanding that we have our own regenerative capacity to improve our certain body wellness. The next important step, or what we call as the next innovation in medical aesthetics, are the external treatments that is available in the market right now. So lift is basically one of our most important aspects that we are looking for, because as we age, everything just tends to drag or go down with gravity. So what we want to do is to reverse it. So these are some of the treatments that is available in the market right now that are really proven, and they are also FDA approved. So one of them is called Ultherapy. It's basically using ultrasound energy to create collagen under the skin. So penetrating deep under the dermis, into the fat layer, into the muscle to create something of a lift is dubbed as the non-surgical facelift. There is no downtime involving this procedure, and it's able to lift the jawline, the mid cheeks, and also reduce the double chin. So this is one of the quite famous treatments that's done in the world. It's done more than 2 million treatments. So there's a video, I'll share the link later. I think we might not have much time for that. The second one is thermage using radio frequency. It helps to tighten up the skin using heat, radio frequency, that helps to stimulate the collagen as it denatures over time. So also non-surgical, it has a procedure time of about an hour, and you'll just need a numb cream just to reduce some of the discomfort from the heat, and it can last up to 1 year. So Ultherapy and thermage being one of the most signature non-surgical facelift treatments that you can use for face, for eye, for neck. It's also another one is the Photona 4D and 6D lift. Well, not going to go too much into it. Basically, it involves full thickness collagen tightening and firming. This is also one of the very latest innovation, FDA approved as well. Then we go into something a little bit more invasive, injectables, because as we age, we lose volume, and we need volume to create some form of projection or to improve depression areas of the face that make us look aged. So we do inject hyaluronic acid to lift, so improving contour, improving depression areas of the face. Wrinkles is also part of aging. So Botox facelift is basically something that is quite common. It's one of the most done procedures in the world. Just that you have to do it under the right doctors to get the good results. Otherwise, it can look a little bit different, or you might have lost your normal expression from there. All right. So Botox and fillers are commonly done procedures to actually prevent aging or to make yourself look better. I'm sure a lot of you have heard about threads before. They are actually inserted under the skin to lift. So they are actually absorbable threads, or what we call them as PDO threads or PLLA threads, because you don't want something that's permanent under the skin as we age. So this is something that is repeatable, can be done over time. As we age dynamically, it can make you look more natural as well. So thread lifts are basically one of the newest innovation, and it's always changing techniques as well as materials used. So there are those who are actually more in favor for something surgical. All right. So if something surgical is needed as the patient is more aged and something that is more required, we would advise them to go for a surgical procedure. The next one basically is using different forms of radio frequency as well, and also microneedling also as well. So the lift program basically is one of the key procedures that we do here, because a lot of times it's about our face, about how we look, first impressions, and also how we demonstrate ourselves as emotional, as we are looking happy, sad. So these are some facial procedures that are really innovative right now in the market. And then we move on into certainly some form of body aesthetics. People are actually promoting a lot of electromagnetic stimulation without going to the gym and improving or getting six-pack abs. So actually, that's not really true. You still need to have a healthy lifestyle, a good diet, and also to work out and exercise regularly. So what we actually employ in my practice is to actually tell them that the magnetic stimulation actually helps in strengthening, improving core muscles, improving muscle function. That's what you can actually improve in your daily lives. It's more functional. So there is something new in the market. All right, they call them the star former or electromagnetic stimulation for certain parts of the body to help to improve our daily lifestyle. So they are actually very good for also rehabilitation and also to reduce pain. So it's like going into a chiropractor, getting the muscle stretched out. But other than just using something physical, this is electromagnetic because it's able to stimulate more circulation, more blood circulation into the area, reducing pain and also improving muscular function. So these are some of the things we do, or some new innovation in the market right now that helps with the body tightening and also to improve body functions. So I hope I have actually spoken enough, not too much in details, but enough to cover wellness internally and externally. And also, this is our philosophy. So hopefully, we can improve all our patients' livelihood, in certain ways. And it doesn't all have to be that expensive. All right. So thank you very much. I think this is certainly some promotions that is you can get in touch with our clinic in the future as well. All right. So I think I'll end this presentation here with a thank you, and I'll pass you back to the floor. Thank you.
Thank you so much, Dr. Tristan. Well, Dr. Tristan, we have received a few questions from our audiences here, and maybe you can try to answer these questions for us.
Sure.
Right, so let's begin with these questions. Will menopause start at a younger age now?
There is a possibility of that because why does the patient, when they reach puberty, they can actually achieve puberty at an earlier stage? Generally, most of the patients, they achieve puberty by 11 or 12, where they have the first menstrual period. But some precocious puberty, or they have more, or their menses coming in the early stage, like 8 or 9 years old, they tend to have menopause at an earlier stage. So it's a very personalized thing that happens physiologically. And because menstrual cycle does come because of ovulation, so it depends on how much eggs that is being used in the end of the menopause that leads them to know whether they are at an earlier age or at a later stage. Yeah.
I see. And does lesser menstrual means menopause will start soon?
Lesser menstrual, yes, because as the ovulation process stops happening, the body or the ovaries will also have less stimulation to produce the female hormones, namely estrogen and progesterone. So when the estrogen basically is the elixir of youth for a lot of females. So it's really important. That's why if the menses stops, the aging will start happening. And it's very different for males and females. Females, basically, if they stop ovulating or they attain menopause, the estrogen level that is imbalanced can cause a lot of aging process to happen, especially more into like dry skin. They have hair loss, or they'll be more frail. They can actually get a little bit more sick easily. So as compared to males basically, because of their testosterone hormone, it gradually drops. It doesn't drop so sudden like what menopause does. So the symptoms are more apparent in females who are going through menopause. So it's very important to detect them. It's very important for them to understand what symptoms they are looking at, like flushing or certain forms of discomfort, to identify them, and then come to us maybe to find or do a screening to find a hormonal imbalance and try to correct them. That's why a lot of doctors, in ONG, obstetrics and gynecology, they do hormone replacement therapies as well for females.
I see. All right. Thank you so much, Dr. Tristan. And here we got another question. Well, is there a possibility that someone has thyroids but could not be detected via the blood test or blood screening?
Yes, of course. Okay, when we talk about thyroid, a lot of times we look at the parameters of the T3, the T4, and the TSH, the thyroid stimulating hormones. Before a disease happens, these hormones tend to gradually drop. But what we normally do is that when we screen, when we see the normal levels, we don't see the abnormalities in them. But what we need to correlate is basically what the patient is going through. Is the patient going through certain forms of mood swings that's not explainable? Is he going through weight gain that is not explainable? Is this something that is happening? Symptoms that might relate to thyroid insufficiency, as the levels tend to look normal, like thyroid stimulating hormones can be a little bit higher. These are suboptimal ranges. So in prevention or regenerative medicine, we tend to actually pick up these signs and symptoms or these blood tests that have warning signs, but not in the sense that you need to treat them with medicine. We will have them to actually look into more and to do more detailed studies into them, and then we can treat them accordingly. So we don't have to wait for these patients to have problems to start medications for them. That will be a bit too late. We will try to detect them early or prevent the disease from happening. That's our role. Yeah.
All right, thank you so much. And now we have come to the very last questions. It's actually my questions. Well, I have actually read a lot of articles regarding delayed aging. It tells me to consume more vitamin C, allow the collagen, boost the collagen on our face to delay aging. So, from a doctor's point of view, can we actually know what's the way or any form that we can use to delay aging?
Yeah, that's a very common question for us. Thank you for that question. How do we delay aging? Basically, is like understanding the extrinsic factor, basically lifestyle, right? Like we say, lifestyle can be very different for anyone. Basically, if just say we have lack of sleep, that could be one of the factors of where it can actually reduce our nutrition deficiency because we don't consume that much or we consume too much. So a lot of times we need to identify the lifestyle that we are adapting. So imagine if you are living in Kuala Lumpur and you are living compared to a person who's living in Switzerland, who is having less stress, same age, but they are going through a different lifestyle as here, they would age very differently. So in one sense, the external part of where we identify the changes, like just say, if you know that we can do a test to screen and to identify certain deficiencies in your body, and then you use that as an indicator for you to age better. There is. I can tell you the innovation. Actually, today's topic is really interesting because we want to find innovative ways to how to age gracefully. So genetic testing is also part of where the future of medicine is going to be to identify what are we deficient in. Because for you and for me, it's also completely different. Even though if we have almost the same age, but we have to find in some ways like what are the factors, and then we use those as an indicator for us to say, okay, you need more vitamin C, you need more collagen, you need more sleep, or you need more proteins in your diet, or you need certain forms of specific things to help you to cope with your metabolism. So it's very different, really. So it's more towards a personalized thing. Yeah. And I think a lot of doctors should be able to identify these things before a disease happens or before it's too late. Yeah.
All right, totally agree with you. So, ladies and gentlemen, if you would like to age gracefully, maybe with the technology, the innovative ideas we have in this world can assist you. All right, so here on behalf of Alliance Bank and all our viewers here, well, let's say a big thank you to Dr. Tristan. Thank you so much for the great sharing.
Thank you very much. You're welcome.
Thank you. All right. So here, ladies and gents, before we begin with the next sessions, don't forget there are many perks in being an Alliance Privilege or Alliance Personal customer. So let me take you through a few offers from both Vinci Medical and Sunway Medical for Alliance Privilege and Alliance Personal customers. So, ladies and gentlemen, just pay with your Alliance Bank Visa Infinite credit card or Alliance Privilege Visa Signature credit card or Alliance Hybrid PB Platinum debit card or the Alliance Hybrid AP Platinum debit card to enjoy the following offers. So over here, we have the Vinci Medical offers. We want you to head over to Vinci Medical during your birthday month with the birthday month gift voucher to enjoy 200 ringgit off for your facelift treatment. And you can also enjoy anti-aging blood test screening. Yeah, the one that Dr. Tristan has mentioned earlier. I'm pretty interested on it. Yeah, so you can also enjoy the anti-aging blood test screening with one session free nutritional IV or fourth therapy at Vinci Medical at 1,000 ringgit. So this is at the normal price of 1,800 ringgit, but now you just get it with just 1,000 ringgit. And also we have the Vinci Medical non-surgical facelift treatment, or you call it the Ultherapy, at 6,888 ringgit, which normal price 12,000 ringgit. Last but not least, make all your physical pain or bodily discomfort go away with pain relief treatment by Photona Star Former first trial at 688 ringgit, which normal price is 1,500 ringgit. So ladies and gentlemen, once again, let's have a look over here. You may use your Alliance Bank Visa Infinite Credit Card, Alliance Privilege Visa Signature Credit Card, Alliance Hybrid PB Platinum Debit Card, or Alliance Hybrid AP Platinum Debit Card to enjoy the following offers. Just now we have mentioned the 200 ringgit off for your facelift treatment during your birthday month, and we have the anti-aging blood test screening with 1 session free nutritional for therapy at Vinci Medical at 1,000 ringgit, which number price 1,800 ringgit, and you also enjoy the non-surgical facelift treatment Ultherapy at 6,888, which normally normal people that without the card need to pay 12,000 ringgit, and last but not least, the Photona Star Formal first trial at a price of 688 ringgit, exclusive for you only, our Alliance Bank card holders. Okay, remember the offers ends at year 2023, February 28. So you have to utilize your benefits before 28th of February 2023. Okay, so after we have complete the promotion sharing on Vinci Medical, it's time for us to tell you more on the promotions we have in Sunway Medical Center. So we have 20% discount on heart screening packages, and this offer is only available at Sunway Medical Center, Sunway City. And this offer ends at 31st August 2022. You got a few more months to go. Okay, and also we have 20% discounts on hospital total bill for scope procedure, cataract, and total knee replacement surgeries. And this offer is only available at Sunway Medical Center, Sunway Below City, and offer ends at 28 February 2023. Okay, you can find more information through the website www.allianceband.com.my/PBAP promotion lifestyle. Okay, we believe that with that you can save more and enjoy more benefits together with us. Okay, so after we have provided you the information on the promotions, we will also like to say a big thank you again to Dr. Tristan. Thank you so much to Dr. Jennifer for the great sharing. And now we would like to say a big thank you to every single one of you. Thank you so much for joining us here on today's session. And you know what can actually make this thank you means more meaningful, ladies and gentlemen? Well, why not we have a lucky draw for every one of you? Yes, we have a total of 20 lucky draw prizes to be given away, and each worth 300 ringgit. Yes, it's the 300 ringgit cash vouchers that we would like to give away. So we hope that you will be the lucky winner walking away with these fabulous prizes. All right. So here, ladies and gentlemen, let me tell you more. Well, how we determine you as the winner. Later, we will bring up the digital lucky draw, okay, mechanism. We will bring up the digital lucky draw mechanism, and we will count 3, 2, 1. And after the count of 3, the winner names will pop up on the screen. If your name pop up on the screen, congratulations, you are the lucky winner. And we're gonna have 20 winners for this round of webinar. So congratulations, those of you who have walked away with these fabulous things, and we hope you all the best with this round of lucky draw over here. All right, so here we have presented you the 300 ringgit cash voucher, the prize that we'd like to give away, especially brought to you by Alliance Bank and Vinci Medical. So we hope you're ready for it. So now without further ado, at the count of 3, 2, 1, please show us the first lucky winner. All right, so the first lucky winner we have here, congratulations to Cindy Chong. Congratulations, Cindy Chong, you walk away with the first 300 ringgit cash voucher. Bravos. Well, no worries, guys. We will contact you real soon for the prize fulfillment. All right, so now let's see who is the second winner at the count of 3, 2, 1. Let's go. Ta-da! Second winner, who we have here? All right, second winner, congratulations to Catherine Ng. Catherine Ng, bravos. Wonderful, you have walked away with these amazing gifts. And now comes to the third winner. Let's see who is the lucky one. 3, 2, 1, let's go. Okay, the third lucky winner we have here. Alex Kwan. Amazing, you are the winner. And now let's go with the fourth winner. The fourth lucky winner we have here. Let's go. Okay, so the fourth lucky winner, this is the one walking away with the 300 ringgit cash voucher, Mary. Wonderful. And now 3, 2, 1, the next winner. The fifth winner we have here. Congratulations to Fun. Congratulations, Fun. And now the sixth winner. There we go. Okay, the sixth lucky winner we have here is Desmond Young. Congratulations, Desmond. And now the seventh lucky winner. The seventh lucky winner we have, walking away with the 200 ringgit cash voucher is Illy Go. Congratulations, Illy. And now the eighth lucky winner. Let's see who's the one. And here we have SKC. Congratulations, SKC. And the ninth person, okay, that's gonna walk away with the 200 ringgit cash voucher at the count. 3, 2, 1, let's go. Jonathan Chua. Well done, Jonathan. Thank you so much for joining us here. And now let's see the 10th lucky winner. Who is the lucky one? All right, the 10th lucky winner. Ta-da! We have Gwendolyn Fletcher. Congratulations, Gwendolyn. You walk away with the 300 ringgit cash voucher, especially brought to you by Alliance Bank on today's Beauty and Wellness Lucky Draw. Ta-da! And now the 11th lucky winner. Here we go. Is Mei Fong Tan. Congratulations, Mei Fong. And now the 12th lucky winner is this lucky man. And here we have Kong Mary. Kong Mary. Brilliant. And now the 13th lucky winner. Ta-da-da! Vincent Ong. Congratulations, Vincent. And now the 14th lucky winner. Pemenang ke-14 yang kita ada di sini, tanya kepada Yong Mei Yi. Kongsilah, Yong Mei Yi. And now the 15th lucky winner. We are now in the 15 lucky winners, right? Yeah, we are. So many prizes to be given away. That's cool. All right, 15 lucky winners. We have Amy Lee. Amazing. Amy, you walk away with 200 ringgit cash voucher. And now we have another 5 more winners. And this, the 16 lucky winner is Kam Wing Woo. Congratulations, Kam Wing Woo. And now the lucky winner number 17 goes to is, let's see, who is the lucky one? All right, 17 winners, we have Chang Kap Sang. Congratulations, Chang Kap Sang. And now the final 3. Yes, the last 3 prizes we have here. And it goes to Agatha Sen. Agatha Sen, congratulations. And now the second last 300 ringgit cash voucher goes to Lokman Yin. Lokman Yin, congratulations. And the final lucky winner we have here at a count of 3, 2, 1, let's go. What is the lucky winner? Dun-dun-dun-dun-dun. Will it be you, or him? All right, congratulations to Lee Feng Hu. Congratulations, Lee Feng Hu. You walked away with a 200 ringgit cash voucher brought to you by today's Beauty and Wellness webinar session. Thank you so much. All right, once again, ladies and gentlemen, we would like to remind all of you who have walked away with the 300 ringgit cash voucher from our lucky draw. No worries on press fulfillment, as we will contact you real soon. And also on behalf of Alliance Bank, we'd like to say a big thank you to every single one of you. Thank you so much for joining us here. Well, I know that we have a little bit of delay at the beginning, but you guys are so supportive. You still stay with us till now. Thank you so much for your support. Thank you so much for your time. We love you, and we believe that in the near future, we can definitely provide you more seminars or more webinars like this to help you in maintaining good health and be beautiful all the time you want. All right, we have come to the end. Thank you so much for joining us here, and wishing you a good night. Stay safe, stay healthy. Goodbye. Oh, don't forget to enjoy promotions, yeah? Goodbye.